Hi, this is Joe Eschman from Eschman Physical Therapy. I would just like to describe one of the techniques that we do here. Is called trigger point dry needling. Trigger point dry needling involves the physical therapist identifying what we call trigger points or taut bands of tissue or fibers within the muscles. Sometimes it's in the back or the neck or the shoulder, but wherever it is, the therapist will identify, find a taut band of tissue. And we know that injections like cortisone injections are great for certain painful conditions, but we also know that a lot of times it doesn't actually take a cortisone injection to relieve pain. Simply, there's a very strong effect that the body has. It's called the needle effect, and a lot of times we can use an acupuncture needle to go into certain areas. These little needles here are what we call hand needles. They're very, very tiny. That's the handle there, and there's the needle. And then in some areas of the body we might use a larger needle. It's kind of hard to see the needle there, but again, the handle is up in this portion and the needle is down here. We generally don't use the entire length of the needle. Might use maybe perhaps a half an inch or so of the needle. But the amazing thing is the acupuncture needle is very different from a hypodermic needle in that it's sharp, but it's not beveled and serrated. The typical hypodermic needle that you get a shot with from the doctor, it's beveled, it's serrated, it's designed to cut and slice into the tissue. The acupuncture needle is designed to pierce into the muscle. You do feel a pinch, but it's not generally a very intense pinch, pretty subtle. A lot of times we'll do what we call a superficial dry needle technique the first time we do the dry needling technique and just gauge your response to the needling. It is quite amazing. A lot of people will get complete elimination of pain following the trigger point dry needling technique. And again, a lot of times people ask, well, what is the difference between acupuncture and trigger point dry needling? Because it is an acupuncture needle that we use. The difference is the acupuncturist is trained in traditional Chinese medicine, whereas I'm trained to use the acupuncture needle in a more westernized approach based on neurophysiology and neuroanatomy. And so we use that acupuncture needle to go into the trigger point, which coincidentally there is about a 60 to 70% correlation between the trigger points and the acupuncture points. So again, sometimes people get a similar result that they might get from acupuncture. Although again, I'm not an acupuncturist and we don't proclaim to do acupuncture, but it is a very good technique and very closely related to acupuncture. But again, if you have back pain, neck pain, hip pain, knee pain, shoulder pain, it's definitely one of those techniques that we would try with you at some point prior to maybe a person moving on to a more aggressive surgical procedure or some stronger pain medications. Thank you.